Perimenopause. The missing conversation. For most of human history, few women lived long enough to face the decades when their ovaries slow and hormones shift. Now that longevity is common, perimenopause is suddenly a frontline health issue and one our medical system still struggles to manage. Hello, this is Dr. K. Paul Stoller, and we all need to understand that perimenopause is not just the lead-up to menopause. It's a distinct, often turbulent state in which the delicate choreography of FSH, LH, estradiol, and progesterone becomes erratic. As ovarian reserves dwindle, the brain pumps out more FSH. That can wake up follicles irregularly, causing wild spikes and crashes of estrogen, and inadequate progesterone when it matters most. For some women, that's a few hot flashes. For others, it's emotional collapse, fractured relationships, and severe impairment. Part of the problem is expectation. Perimenopause is often reduced to a single question: do you want hormones? The shadow of the 2002 Women's Health Initiative still scares clinicians and patients. But the reality is nuanced. Absolute cancer risk from well-chosen, well-timed hormone therapy is small for many women, and age, timing, and preparation change the balance of risks and benefits. Modern life makes perimenopause harder. Endocrine-disrupting chemicals, phthalates, bisphenols, microplastics, agricultural residues can blunt progesterone synthesis and skew estrogen signaling. Layer on poor nutrition, chronic infections, or toxic burdens, and the hormonal tides become even more volatile. These are real understudied drivers of infertility, worse PMS, and harsher perimenopause. Perimenopause should be a moment for diagnostic clarity and self-care, not reflexive prescribing. Ask broader questions: insulin resistance, thyroid or liver issues, heavy metals, MTHFR and methylation, nutrient gaps like vitamin D or methylfolate. Treating the whole person: sleep, gut health, tailored exercise, stress reduction creates the foundation for good outcomes. When hormone therapy is appropriate, nuance matters. Lowest effective dose, individualized formulation, careful monitoring. For many, bioidentical progesterone for luteal support restores balance. For some, attention to oxytocin, psychosocial repair, or targeted metabolic care is essential. The clinician's role is to partner, explain mechanisms, weigh priorities, and adjust over time. Perimenopause is also social. Women whose symptoms are coded as stress or mood disorder fall through the cracks. Families need education, medical training must improve, and at a public health level we must reduce endocrine exposures and strengthen nutrition and social supports. Reframe perimenopause. It's a transition to be understood, investigated, and treated with compassion. Ask questions, demand nuanced care, and make the middle years a time of renewal, not misunderstood suffering.